So next, what I'm doing next is I'm going to listen to all of the lobes of the lungs. And I'm going to look at anteriorly first. So whenever I'm looking at it, I'm going to use the diaphragm of my stethoscope. And then I'm going to start in the anterior. So the anterior portion has the right middle lobe as well. So I do a Z formation as well. And you do it on bare skin, but I'm not doing it on bare skin. So you start with the right upper lobe. Then you move to the left upper lobe. Then you go to the right middle lobe, which is over here. Go to the left lower lobe. And then we're going to the right lower lobe. And every time you do this, you ask your patient to take a nice deep breath when they're doing this. And then I'll do this for the same for the back, but the back doesn't have a right middle lobe. So I'll do the right upper lobe, deep breath in, out. Then I go over to, it's hard to do it. And then I go over to the left upper lobe. Then I go to the right lower lobe, and then the left lower lobe. And have my patient do a deep breath every single time. I'm doing that to assess it, and their breath sounds look good. I don't have any signs of crackling or anything, or straining to breathe. Whenever I test look at my patient too, I see their shoulders are symmetrical. Have them bend over, look at it. They don't have any signs of scoliosis, kyphosis, lordosis, or anything like that. So their respiratory system looks nice and healthy. There's no abnormalities with that. No signs of bruit, crackles, wheezing, nothing like that. So then next, what we are paying attention to is that we are paying attention to the chest with the heart. So first with my patient, I'm going to palpate the carotid pulse. And what's a good thing to know is when you're palpating the carotid pulse is that you have to do it unilaterally, or it can get abnormal results from doing it both sides. So you do it unilaterally when you're doing it. And usually every patient lay down at a 45-degree angle as well. And when I do the carotid pulse, I notice that there is no thrill. I don't feel a thrill at all with it at all. And then you can listen to it as well for a bruit, and my patient doesn't have any bruit or anything with it. I don't have any jugular vein distension present with my patient. It seems to be nice and normal within ranges. No distension of the jugular vein. So then there's no signs of edema as well, no swelling, redness, lesions, or that. So then I'm going to palpate my left and right radial pulses. I use my 2 fingers because my thumb has a pulse of its own. I do my left radial pulse, which is a 2+, and then I do my right radial pulse, which is a 2+ as well, bilaterally. So that is nice and good. So then I'll do my dorsal pedis pulse and my posterior tibialis pulse. It's hard to do it, but my dorsal pulse is down here on my foot, and my posterior tibialis pulse over here. And then I palpate those, and they're both a 2+ bilaterally as well on both of them. So that's nice and healthy. So lastly for the chest is that I'm going to auscultate my valves in my heart. So I use the diaphragm and the bell of my stethoscope when I do this, but first I'm going to use the diaphragm of my bell. So first what I'm going to do is I look at the aortic valve in my heart, which the aortic valve is the only one that's on the right intercostal, right sternal border. So I look on the second right intercostal, right sternal border right here, and I listen to it. Then I'll move over for my pulmonic valve, which is my second left intercostal, left sternal border. And I listen to that on the left side. And then I go to my Erb's point, which is in the third right intercostal with the right sternal border, a down one. And then after that, you go to the tricuspid valve, which is, I learned in class that it was the 5th intercostal, but a lot of different things say the 4th intercostal, but that's 5th or 4th left intercostal, left sternal border. So the only one that's on the right sternal border is the aortic valve. And then you go to the mitral valve, which is on women, you lift up the breast a little bit to get to it, but it's the 5th intercostal, left mid-clavicular line, which is right midway from your clavicle. And you listen to that with your diaphragm, and then you do it all again with the bell as well. And then you'll all have a nice 2+ pulse with all of those as well. So their cardiovascular system looks to be nice and in check. Breath sound good. I don't feel have any types of murmur or any types of abnormalities with the pulses of the heart or the valves. They all seem to be nice and good. S1, S2 nodes closing, opening with the valves. So nice and healthy. So whenever I look at the chest, I go down to the abdomen. So when I'm looking at my patient's abdomen, it's nice and symmetrical. The contour looks good. There's no signs of distension in the abdomen, nothing that's be like filling or anything of like fluid or edema, nothing like that. So first what I'm going to do is I'm going to auscultate the bowel sounds, because you first want to listen to it instead of palpating, because if you palpate, it can make the bowel sound irregular. So whenever I am listening to it, you always start with the right lower quadrant of your abdomen, because that's the most active spot in your bowel. So I'll listen with the diaphragm of my stethoscope, and I listen to right here, which is my right lower quadrant. Then I move up to my right upper quadrant and left upper quadrant, and then my left lower quadrant, and you listen to it all 5 minutes. And then you lightly palpate each of them in the same exact order from the right lower quadrant, right upper, left lower quadrant as well. And you note any tenderness or distension of the abdomen whenever you're palpating as well, or pain, and so forth. And then you can also add in different questions about like urination, pain with urination, or anything like that to stay in check. So next what we did is that we looked at the muscular system of it. So I'm looking at my patients, inspecting my patients' upper joints, and I'm looking at the shoulders and their wrists. So when their wrists move and up, their joint size seems to be nice and symmetrical. The contour looks good, and they're equal bilaterally. The shoulders are good. The joint size looks nice, symmetrical. Contour looks good, and they're both the same bilaterally. No unsymmetrical shapes or anything of them. So I look at the lower part of my body, and I notice that the hips of the body are nice and symmetrical. The contour, the hips look good, and they're even bilaterally. Same with the feet. Their contour symmetrically looks good, and they're both the same bilaterally. So then next we're going to actually assess the muscles and the range of motion of the upper extremities and lower extremities. First we do the upper extremities, so we're doing the elbow and the neck. So the range of motion of my neck is going to be nice and normal. It's a 5+ with range of motion, and bilateral on both sides can do it, so that's good. Elbows, I flex it and extend it, and I rotate, external rotate it, internal rotate it, and it's all good with range of motion with the 5+, and it's all bilaterally in both arms. I can do it easily in both arms with no pain. And then I assess the lower extremities, which I'm assessing my knees and my ankles. So when I'm assessing my ankles, I flex and extend it, and I can move it rarely, or not rarely, but like very cautiously, and how far I can move side to side. And so the range of motion is a 5+ as well, so bilaterally on both sides as well. So then I look at my ankles, and I can move my ankles, dorsal flex it, dorsally extend it, move it internal, external, and it's nice and has good range of motion. I can move it around. So it has a 5+ range of motion, and it's equally bilateral. The function of my lower extremities seems to be nice and even gait. No shuffling or anything with walking. It seems to be nice and strong. There's no signs of abnormalities or struggling whenever they're walking. The lower extremities seem to be nice and good and function well. The muscle strength of both the upper and lower muscles in the body seem to be nice and equal of a 5+ range of motion and 5+, 2+ or whatever of the muscle strength. So the upper extremities and lower extremities seem to be nice and intact, nice and healthy, and nice and well done. So that concludes our exam today. And I'm thanking you for your time and letting me do the head-to-toe assessment. Can you tell me your pain level after this assessment, from a 0 to 10, 0 being non-existent to 10 being worst ever? where it's at, what it feels like? Okay, perfect. So here I'm gonna put the rails up on your bed. I am locking your bed in place to make sure it's good and it's at the lowest it can be. Here's your call light on the side of you over here. It's in good range. Thank you very much for your time and letting me do my exam. I do my hand hygiene again like I did in the beginning and end. And that concludes our video. Also, you might see a little break in the middle of this. It's because my dog accidentally hit the button, so I just put my videos together. But it is practice. But I promise I was sitting in the same spot. Anyway, thank you.